Are you currently suffering from pain or swelling over the outside of the ankle? Have the feeling that the ankle is unstable or could give away? These are classic symptoms of lateral ankle sprain, and since 30 to 50% of people that suffer from initial injury will develop chronic ankle instability, we are going to explain why just resting the ankle until the pain goes away is not the answer. Hey everyone, this is Dr. Zach Greenwade here at Performance Sport and Spine in Seattle, Washington. In today's video, I'm discussing lateral ankle sprain treatment so you can avoid injections or surgery. The ankle joint is a hinge joint, and it connects the two bones in your lower leg, the fibula and the tibia, to the talus. And this joint allows you to run, jump, and cut. The most common mechanism for this is when your ankle rolls outwards, placing stress that can cause either stretching or tearing of those outside ligaments. This often occurs during activities where the foot unexpectedly twists or lands unevenly, such as stepping off a curb, landing awkwardly from a jump, or during sports that involve sudden change in directions, such as basketball or soccer. There are a lot of ligaments in the ankle to give it stability, but the most common one is the anterior talofibular ligament that's injured, followed by the calcaneofibular ligament. And the two biggest risk factors for this happening is a previous ankle injury or being young. Some other things that can contribute to this is poor posture, elevated BMI, and then poor hip and ankle strength. So the outside or lateral part of the ankle is sprained way more often than the medial or inside, and that's for two reasons. The ligaments on the inside are far stronger, so they're less likely to get damaged, as well as the bone contact is much closer and longer, so it's much harder to sprain the inside of your ankle than the outside of your ankle. Lateral ankle sprains typically present as pain and or swelling over the front middle portion of the ankle, with more severe injuries having bruising or palpable defects. There are three different grades going from mild, moderate to severe in terms of the amount of damage, and it's estimated that 1 in 50 people will suffer an ankle sprain at some point in their life, and it's the most common sports injury. And with 30 to 50% developing chronic symptoms, you can't just wait till the pain goes away, you have to treat it. And these symptoms can be anywhere from pain, instability, or the feeling or sensation of giving away. So before we start the exercise, we're going to talk about this thing called proprioception, which basically means if I close my eyes, I can still know that my hand is here in space. Well, what happens when you hurt your ankle, sometimes you kind of lose that ability to know exactly where your ankle is. So it's not just about getting it stronger, it's about knowing that where it's in space and that motor control. So when you're doing these exercises, don't just think about, is it getting stronger? But also think about, am I getting more confident? Am I getting better control and awareness of that ankle joint? There's four primary movements of this joint: plantar flexion, or pointing your toes away; dorsiflexion, or bringing your toes up; eversion, bringing your bottom of your foot inwards; and then eversion, putting the bottom of your foot outwards. For the first level exercises, you need a bench or a chair and then a PT band like this. If you don't have one, there's a link to order it online. You're going to tie it with a loop and then a knot, and then place it over the affected ankle and foot. With the band on the front of your foot, make sure your heel's on the ground, pull some mild tension, and then press your toes and the top of your foot down towards the floor, and then return to the starting position. Make sure to feel tension in the back of your calf, and then adjust resistance to your current symptoms. For dorsiflexion, or pulling the toes towards your head, you're going to put your other foot to anchor the band and then bring your affected foot back a little bit. And then in neutral, with your heel on the ground, we're going to use the front of our shin to pull our foot up towards our knee and then back. Again, if you need to make it a little more challenging, bring your heel closer to you and again, pull up towards you and back. You want to feel tension right here on the front of your shin as you do this. Eversion, with the other foot anchoring the band and your heels on the ground, we're going to roll our foot out so the bottom of our foot turns away and down, and you should feel tension on the outside portion of your calf. Eversion, so holding the band away from you, we're going to put a foot down and towards the midline of our body. And again, here you should feel tension on the inside front portion of your calf. Make sure to hold the band up and away at a 45-degree angle. Band-aid crab walk. With a small PT band around the middle of your foot, we're going to take a step forward and then forward, but try to go forward and out. And as you press out, you're going to feel tension over that lateral part of your ankle. Again, to increase the difficulty, we can make it even wider. Level 2 exercises will be weight bearing. The first one is a foot inverted tripod. So if my left ankle is the painful one or instability one, I'm going to stand on it, tap my right foot forward, back to the right, and then back to the left. I'm trying to keep as much control and balance on my left ankle, and I'm just tapping with my right foot. I'm not trying to use any weight into it. To increase the difficulty, you can bend your knee more or make your Y bigger. Restoring balance is really important, so here's 4 tiers of exercises to help you do that. So the first one's going to be just kind of a staggered stance with your right foot having not that much weight. My left ankle is the affected one with just a little bit of balance. From there, we're going to try to go midline and hold that. Once you can hold that for 30 seconds, we're going to progress to a single leg. And then once you can hold that, we're going to close our eyes and work up to 30. And 2 good accessory exercises is working on the big toe flexor and these peroneal muscles on the outside of the leg. So for the first exercise for the big toe, again, we're going to use that small PT band. You're going to place it under your toe, pulling some tension up, bring your toe up, and then press down. And again, if it's a little bit too hard, you can adjust, but try to keep your foot on the ground and just lift your big toe up and then press to the ground. Again, try to move just your toe and not your foot. With a PT band anchored on one side and above your knee on the other, we're going to work these peroneal muscles. So what we're going to do is try to keep our foot flat, bring our knee in, and then press or roll our knee out. And again, as you bring it outwards, you should feel tension over the outside of that shin. If you want to make it a little more challenging, step wider apart and again, roll your knee in, keeping your foot flat and pressing your knee out. Now we've strengthened the ankle, but with running, there's thousands of times of your foot contacting the pavement, the gravel, or the trail. So we need to kind of build confidence and tissue tolerance to that. These next set of drills are going to go from kind of easy to more advanced and help you prepare that ankle for running. Level 1 toe tap. So in a seated position, we're just going to tap our toes back and forth, going faster and faster. And again, you can smash them harder down to increase the difficulty. Level 2 is seated jogging. In that same position, we're just going to sit and jog. And again, you can go faster, lift your heels up higher, but again, this is preparing those feet and ankle for running. Flexion walks. So raising up onto our toes, we're going to walk, keeping our heels as high as possible and feel tension in the back of your calf. Next drill is called a rocker. So we're going to be by a wall in case we need stability. And we're going to roll up onto our toes, down to our midfoot, and then back to our heels. To our midfoot, up onto our toes, midfoot, heels. Lastly, just some light jogging in place. We recommend doing this on the floor or grass or gravel first and then progressing to concrete. That's harder. And with ankle sprains, there's always a chance that there's a fracture of one of the bones in the foot or the ankle. So it's really important to rule that out. And the auto rules is really good because it has a high sensitivity in the sense that if it's negative, you can be very confident that there is no fracture. Now, if it's positive, it's harder to know, but again, it's really a good way to know I don't have a fracture. The rules that indicate when an x-ray is needed are there's pain or tenderness over the distal 6 centimeters of the fibula, or B, there's bony tenderness at the distal 6 centimeters of the tibia, or an inability to take 4 steps immediately after injury. Thank you for watching our video on lateral ankle sprains. This should give you a comprehensive guide of knowing what it is, how to rehab it, and then get back to running. If you did find the video helpful, please like it and subscribe to our channels, and we have lots of other great videos out there.